And the COVID-19 public health emergency officially ends on May 11th.
Yeah, we'd like to bring in our medical expert, Dr. Samir Islam, tonight with a look at some of the changes that you can expect. Dr. Islam, one of the first things the public will start noticing is testing will no longer be free.
That's exactly right. All the testing that we've had, both by doctors who prescribed them and the tests we got home, were completely free. After May 11th, that is going to change.
What about COVID vaccinations, Doc, just as a rule for all of us? What's the plan there for the future? Do we need more?
I think that we're going to have probably more vaccinations, but I do suspect that the vaccination is going to still be free. Under the Affordable Care Act, it mandates you have protective services for screening tests, including things like COVID and the flu. What I do think is going to happen is that each individual insurance plan will determine which vaccine is going to be covered. So I would encourage you to contact each plan or your plan to see exactly which vaccine will be covered for you.
Let's talk a little bit about Pfizer and Moderna. Do you think they'll increase the price of those vaccines now the government is no longer footing the bill?
I think there's an excellent chance that may happen. So I would just keep an eye out and see exactly what's going on. Once again, the most important thing is to contact your insurance company to find out exactly which vaccination will be covered and which one won't, so you won't be surprised.
So no mandates for folks, but will there be any protocol changes for folks like healthcare workers, federal workers, foreigners who may be flying into the U.S.? Will that still be around at all?
So in the past, all of those groups of people had to have a COVID vaccine to work. That is going to change completely on May 11th. That is not going to be mandatory. So you may have heard the story of Novak Djokovic, the tennis superstar, who couldn't play in the U.S. Open because he was not vaccinated. After May 11th, that's not the case, and so you may see him in August playing in New York in the U.S. Open.
All right, one last question for you tonight. Do you think people who want to get the vaccine, should they do that before that deadline?
Absolutely. It's free. You know exactly what you're getting, and you don't have to worry about which vaccine is going to be covered or not. I have no doubt at all that you should go and get the vaccine. Keep in mind, even though the public health crisis is over, it doesn't mean that COVID is over. It's going to be around for a long time. We know that the vaccine helps prevent death and prevent hospitalization as well.
Still getting it here and there all over the place. Dr. Samir Islam, thank you as always. We appreciate it. Talk to you soon.
Thanks for having me on.